Namaste. Good morning. Namaskara. Vanakkam. An absolute joy to be here. I'm ecstatic to be here because I studied just up the road. 1990 to 92, I was doing my pre-university studies at MES College, and I did not realize I'll be here one day talking to you about what is the most important thing, the health and women's health. ಎಲ್ರಿಗೂ ಕನ್ನಡ ಬರ್ತದಾ? ಲವ್ಲಿ. ವಸುಧೈವ ಕುಟುಂಬಕಂ. One world, one family. This is the state we are in today. One world, one family. We are living in an era of joy, happiness, at the same time some problems which have to be tackled. Today I'm here for the next 45 minutes or an hour to tell you how we can make our living better. There is nothing more better than awareness, the knowledge that you spread among your colleagues, friends and family. ಸಂಸ್ಕೃತದಲ್ಲಿ ಒಂದು ವ್ಯಾಖ್ಯಾನ ಇದೆ. ಜನ್ಮನ ಜಾಯತೆ ಶೂದ್ರಃ ಸಂಸ್ಕಾರೈ ದ್ವಿಜ ಉಚ್ಯತೆ ವಿದ್ಯಾಯ ಯಾತಿ ವಿಪ್ರತ್ವಂ ತ್ರಿಭಿಃ ಶ್ರೋತ್ರಿಯ ಉಚ್ಯತೆ. So there is nobody superior apart from the one who has actually gained that knowledge. Knowledge is the most superior thing, and I'm here today to share that, to learn from you and how we can make our living better. When I was asked to talk about longevity, is it a boon or a bane? ನಮ್ಮ ಒಂದು ಜೀವಾವಧಿ ಏನಿದೆ, whether living for longer, is it a pleasure or a pain? ಹೆಚ್ಚಾಗಿ ಬದುಕಬೇಕು ಅಂತ ಕಳ್ತದ್ದು ಒಂದು ವರವ ಒಂದು ಶಾಪವ ಅನ್ನೋ ಒಂದು ವಿಚಾರವಾಗಿ ಮಾತನಾಡಲಿಕ್ಕೆ ಹೇಳಿದ್ರು. I was thinking, how can I connect the human touch, what we doctors give to a great extent, to technology, to advances that we have made in medicine, and how we can prevent that pain and convert that more into pleasure and make living a happy one. This was my thought. ಒಂದು ತಾಯಿ, ಒಂದು ಮಡದಿ, ಮಗಳು, ಹೀಗೆ every aspect of one's life there is a female component to it. ತಾಯಿ, ತಾಯ್ನಾಡು, ತಾಯಿ ಭಾಷೆ, pen ultimate three things, and when such is the thing, the power of woman is extreme. She is the pen ultimate creator of this world, and it's our job to look after her. And with that thought, I said, let me connect health, longevity and women's health, because the most important thing that we need to do today is looking after ಈ ದೇವತೆಗಳ ಆರೋಗ್ಯವನ್ನು ನೋಡ್ಕೊಳ್ಬೇಕಾದಂತೂ ನಮ್ಮ ಕರ್ತವ್ಯ. Looking after you angels is our responsibility, and I'm very grateful that I was asked to come here to talk about it. Today, we are living about 70 years in Bangalore. ನಮ್ಮ ಜೀವಾವಧಿ 70 ವರ್ಷಗಳು. If you actually look at what we were before, going back to the 1950s, the average lifespan was about 40 years. 40 ವರ್ಷದಿಂದ ಈಗ 70 ವರ್ಷಕ್ಕೆ ಬಂದಿದ್ದೇವೆ. Along with the age, we've also got problems that have come across us. ಆರೋಗ್ಯ ಅಂದ್ರೆ ಏನು? What do you mean by health? This one slide, somebody has spent 30 years thinking about what health is. ಆರೋಗ್ಯ ಅಂದರೆ ಏನು ಅಂತ ಸುಮಾರು 30 ವರ್ಷಗಳ ಕಾಲ ಅಧ್ಯಯನ ಮಾಡಿ they went on to say it is a combination of physical, physiological, psychosocial well-being. ದೈಹಿಕವಾಗಿ, ಮಾನಸಿಕವಾಗಿ, ಸಾಮಾಜಿಕವಾಗಿ ನಾವು ಆರೋಗ್ಯವಾಗಿ ಇದ್ದಾಗ ಮಾತ್ರ ಆರೋಗ್ಯವನ್ನು ಪಡೆಯಲು ಸಾಧ್ಯ ಅಂತ ಹೇಳ್ತೇವೆ. Next slide, please. This is what I was just talking to you about. If you look at 1940, look at the lifespan. 37 ವರ್ಷ was the average lifespan of a human being. Look at where we are today, about 70 years. Why do we get cancers? Why are we talking so much about cancers? Why is the bank talking about improving your health care? Helping you to have security for your health care is precisely this. Look at this tree. Idu ondu alada mara. The longer the tree lives, it is quite normal for the tree to get into trouble. The barks get rotten, we remove the bark, and the tree goes on to live for longer. Similar is the thought process with cancers. Cancer on the kaile alla. It is not a disease. It's a stage of evolution. If you actually look at how much of trouble we have had with our health, it constitutes to about 60%. 60% of the deaths and the disabilities we are seeing today. ಇಲ್ಲಿ ಎಲ್ಲರಿಗೂ ಗೌತಮ ಬುದ್ಧನ ಬಗ್ಗೆ ಗೊತ್ತಿದೆ. Gautami was one of the disciples of Gautama Buddha. ಸಾವಿಲ್ಲದ ಮನೆಯಿಂದ ಸಾಸುವೆ ಕಾಳ ತಾರಮ್ಮ ನಾ ನಿನ್ನ ಮಗುವನ್ನ ಜೀವ ಕೊಡ್ತೇನೆ ಅಂತ ಬುದ್ಧ ಹೇಳ್ತಾನೆ. That is how common death is, because Gautami could not come back with a mustard seed from a house which has not seen death. That is how common our non-communicable diseases today are. ಸಾಂಕ್ರಾಮಿಕವಾಗದೇ ಇರತಕ್ಕಂಥ ಕಾಯಿಲೆಗಳಿವು. ಡಯಾಬಿಟೀಸ್, ಹೈಪರ್ಟೆನ್ಷನ್, ಸ್ಟ್ರೋಕ್, ಕ್ಯಾನ್ಸರ್ಸ್. ಹಾಗಾಗಿ ಪ್ರತಿಯೊಂದೊಂದು ಮನೆಯಲ್ಲಿ ಇರತಕ್ಕಂಥ ಕಾಯಿಲೆ, ಸಾಂಕ್ರಾಮಿಕವಾಗದೇ ಇರತಕ್ಕಂಥ ಕಾಯಿಲೆಗಳು ಇಂದು. ಬಹಳ ಮುಖ್ಯವಾಗಿ ಹೇಳ್ತಕ್ಕಂಥ ವಿಚಾರ ಅಂತಂದರೆ, ಐ ಟಾಕ್ಡ್ ಅಬೌಟ್ ಕ್ಯಾನ್ಸರ್. ಬಟ್ ವಾಟ್ ಈಸ್ ದ ಲಿಂಕ್ ಬಿಟ್ವೀನ್ ದ ನೇಚರ್, the nurture we go through and the mind? ಬಹಳ ಮುಖ್ಯವಾದದ್ದು. ನೆಕ್ಸ್ಟ್ ಸ್ಲೈಡ್ ಪ್ಲೀಸ್. ಥ್ಯಾಂಕ್ ಯು. ಇಲ್ಲಿ ನೋಡಿ, ಭಾರತವನ್ನ ವಿ ಕಾಲ್ ಇಟ್ ಆಸ್ ಎ ಡೆವಲಪಿಂಗ್ ಕಂಟ್ರಿ. ನಿಜಾಂಶ, ವಿ ಆರ್ ನಾಟ್ ಎ ಪೂರ್ ಕಂಟ್ರಿ. ವಿ ಆರ್ ಇನ್ ಎ ಸ್ಟೇಜ್ ಆಫ್ ಎಕ್ಸೆಸ್. ವಿ ಆರ್ ಗೋಯಿಂಗ್ ಥ್ರೂ ಎ ಫೇಸ್. We are seeing the effects of excess in us. ನಾವು ತಿನ್ನತಕ್ಕಂಥ ಆಹಾರ, ನಾವು ಬಳಸ್ತಕ್ಕಂಥ ಪಾನೀಯಗಳು, ನಮ್ಮ ಒಂದು ಜೀವನ ಶೈಲಿ ಇದಕ್ಕೆಲ್ಲದಕ್ಕೂ ಕಾರಣ. ನಮ್ಮಲ್ಲಿರ್ತಕ್ಕಂಥ ವಾಯುಮಾಲಿನ್ಯ, ಜಲಮಾಲಿನ್ಯ ಮತ್ತು ಆಹಾರ ಮಾಲಿನ್ಯ ಈ ಕ್ಯಾನ್ಸರ್ಗಳಿಗೆ ಬಹಳ ಮುಖ್ಯವಾದ ಕಾರಣವಾಗ್ತದೆ. ಈಜಿಪ್ಷಿಯನ್ ಭಾಷೆಯಲ್ಲಿ ಒಂದು ಸೊಗಡಿದೆ. A quarter of what you eat is for you, 3/4 is for the doctors who look after you ಅಂತ. ಅಪ್ಪಟವಾದ ಸತ್ಯ. ಸೊ ಹಾಗಾಗಿ ನಾವು ತಿಂತಕ್ಕಂಥ ಆಹಾರ ಯಥೇಚ್ಛವಾಗಿ ತಿಂತಿದ್ದೇವೆ, ಬಳಸ್ತಕ್ಕಂಥ ಪಾನೀಯಗಳನ್ನು ಯಥೇಚ್ಛವಾಗಿ ಬಳಸ್ತಿದ್ದೇವೆ ಮತ್ತು ಒಂದು ಸುಖವಾದ ಜೀವನ ಶೈಲಿಯನ್ನು ಅಳವಡಿಸಿಕೊಂಡಿದ್ದೇವೆ. I want you all to just run through a small psychological exercise. ಬೆಂಗಳೂರು ಬಹಳ ಬಿಸಿಯಾಗಿದೆ. ಹಾಗಾಗಿಯೂ I want to just run through this 60-second exercise. I want you all to close your eyes. ತಾವೆಲ್ಲ ತಮ್ಮ ಕಣ್ಣುಗಳನ್ನು ಮುಚ್ಕೋಬೇಕು. ತಮ್ಮ ಕಣ್ಣುಗಳನ್ನು ಮುಚ್ಚಿ ತಮ್ಮ ಶ್ವಾಸದ ಮೇಲೆ ನಿಗಾ ವಹಿಸಬೇಕು. I want you to close your eyes. Start concentrating on the breathing. Take a deep breath in. Hold it. Breathe out. Take a deep breath in, hold it, breathe out. You can feel that air gushing through your nose to the back of your throats, hitting the bottom of your lung. And as you breathe out, you can sense that coming out. When you have started to do this, you realize your heart is beating quietly there. Lub, dub, lub, dub. It's beating quietly there. Suddenly, a thought comes to your mind. There's a message that's popped into your phone box saying that one of your kin, your father, your mother, your brother, your husband has been diagnosed with cancer. your heart starts racing, your breaths start becoming more shallower, and there's a fear in you. ಒಂದು ರೀತಿಯ ಭಯ, ಭೀತಿ, ಕಗ್ಗತ್ತಲು. I just want you to express your thoughts in one word. Please open your eyes, ladies and gentlemen. ಈ ಒಂದು ಸಣ್ಣ ವಿಚಾರ ತಮ್ಮೆಲ್ಲರಲ್ಲೂ ಒಂದು ರೀತಿಯ ಭಯವನ್ನ, ಒಂದು ರೀತಿಯ ಭೀತಿಯನ್ನ, ಒಂದು ರೀತಿಯ ಸಾವಿನ ನೋವನ್ನ ತರ್ತದ. This is what we all go through when you realize a member of your family has been diagnosed with cancer or suspected to have cancer. But this is all not true, which we will see in the next few minutes. This is what the problem is. The problem is cancer is not new, and we see about 1.8 to 2 crore cancers in a year. That's quite a lot. This is worldwide. But if you actually look at it, the number of cancers we have started to see in Asia is going up. Why are we seeing more cancers? One, we are living longer, but we want to live longer. Secondly, there are better diagnostics, better treatments, and awareness. A very important thing, and that's the reason we're all here assembled today, to know more about it, creating awareness. Affordability, I think that is where the banks are coming into play. See, the state insurance, the banking sector, these are the people that are helping us out with the finances required for cancer care. Pre-independence, healthcare was a state object. The government used to look after. Even now, it's a state matter, it's a central matter, it's a constitutional matter. However, what the government has done is, from being a healthcare provider, it has become a healthcare insurer. And that is what the public sector units are doing now, which is actually helping us to a great extent. And we talk about risk factors. That is where we want to talk today, how we can reduce the risk factors that lead on to cancer and the interplay between the nature, nurture, and the mind. We talked about how it causes death and disability. The next few minutes, I'm going to just tell you a bit about health and wellness, the molecular basis to cancer, how much of a problem it is, and how we can prevent it. This is what I'm going to do. This is the cancer journey. We talk about journey, and the cancer journey is a difficult one. Especially those who are not in the medical field, you cannot understand what goes on behind the screens. And I'm here to just unfold what may be happening at the back. That's the intention. Cancers are not new. Cancers have been here times immemorial. And in fact, if you go back to Ayurveda, it talks about karkata. In Sanskrit, karkata means crab claws. And the reason that symbolic representation of crab is it invades, it causes pain, it crawls, it is tough. That's the reason Karkata was given, and truly we have gone quite far. Today here, we are talking not only about living longer, but we are talking about living well. Especially in women. Tai, tangi, magalu, hige, I think women's health is the most vital aspect. A well mother is a well family. I think that's what is important, and that's what we are trying to talk about. So if you look at the breast, ಸ್ತನಗಳು, ಸ್ತನದ ಕ್ಯಾನ್ಸರ್ ಬಹಳ ಮುಖ್ಯವಾದಂಥ ವಿಚಾರ. ವಾಟ್ ಈಸ್ ಕ್ಯಾನ್ಸರ್? ಕ್ಯಾನ್ಸರ್ ಅಂದ್ರೇನು ಅಂತ ಈ ಒಂದು ವಿಚಾರದಲ್ಲಿ ತಿಳ್ಕೊಳ್ಳೋಣ. ಐ ಆಮ್ ಶ್ಯೂರ್ ಲಾಟ್ ಆಫ್ ಪೀಪಲ್ ಹಿಯರ್ ಅಂಡರ್ಸ್ಟ್ಯಾಂಡ್ ಎ ಬಿಟ್ ಆಫ್ ಬಯಾಲಜಿ. ಈ ಮಾನವ ಶರೀರ ಅಂತಕ್ಕಂಥದ್ದು, ದ ಹ್ಯೂಮನ್ ಬಾಡಿ ಈಸ್ ಅನ್ ಅಮೇಝಿಂಗ್ ಆರ್ಗನ್. ಇಟ್ಸ್ ಒನ್ ಆಫ್ ದ ಫೈನೆಸ್ಟ್ ಕ್ರಿಯೇಷನ್ಸ್ ದ ಮದರ್ ನೇಚರ್ ಹ್ಯಾಸ್ ಕ್ರಿಯೇಟೆಡ್. ವಿತಿನ್ ದಿಸ್ ಯು ಹ್ಯಾವ್ ಗಾಟ್ ವೇರಿಯಸ್ ಆರ್ಗನ್ಸ್, ಆ್ಯಂಡ್ ವಿತಿನ್ ದೀಸ್ ಆರ್ಗನ್ಸ್ ಯು ಹ್ಯಾವ್ ವೇರಿಯಸ್ ಸೆಲ್ಸ್, ಕಣಗಳಿರ್ತವ. ಆ ಕಣಗಳ ಒಳಗಡೆ ಜೀವಕೋಶವಿರ್ತದ, ದಟ್ ಇಸ್ ದ ನ್ಯೂಕ್ಲಿಯಸ್. ಆ ಜೀವಕೋಶದ ಒಳಗಡೆ ಯು ಹ್ಯಾವ್ ಕ್ರೊಮ್ಯಾಟಿನ್, DNA, RNA ಅಂತ ಹೇಳ್ತೇವೆ. ದಿಸ್ ಇಸ್ ದಿ ಡಾಟಾ ಫಾರ್ ದ ನೆಕ್ಸ್ಟ್ ಸೆಲ್. ಹಲವಾರು ಕಾರಣಗಳಿಂದ there may be damage to this chromatin. That damage, when it happens, you have a bad cell that is born. The body kills this bad cell. ಹುಲ್ಲಿನ ಮಧ್ಯೆ ಕಳೆ ಹೇಗಿರ್ತದ ಹಾಗೆ ಕಳೆಯನ್ನ ನಮ್ಮ ದೇಹ ಹಾಳು ಮಾಡ್ತದ. ಸೊ ಇಟ್ ಡೆಸ್ಟ್ರಾಯ್ಸ್ ದ ಬ್ಯಾಡ್ ಸೆಲ್. ಬಟ್ ಅನ್ಫಾರ್ಚುನೇಟ್ಲಿ when the body loses the ability to destroy this weed, ಈ ಕಳೆ ಯಥೇಚ್ಛವಾಗಿ ಬೆಳೆದು it forms a lump, and that is all cancer is. Every cell in the human body has the potential to become a cancer. That is all cancer is. So ladies and gentlemen, ಇಲ್ಲಿವರೆಗೂ ನಾನು ಆರೋಗ್ಯ ಅಂದ್ರೆ ಏನು, ವಾಟ್ ಇಸ್ ಹೆಲ್ತ್, ಕ್ಯಾನ್ಸರ್ ಅಂದ್ರೆ ಏನು, ಇಟ್ ಇಸ್ ನಾಟ್ ಎ ಡಿಸೀಸ್, ಇಟ್ಸ್ ಎ ಸ್ಟೇಜ್ ಆಫ್ ಎವಲ್ಯೂಷನ್, ಮತ್ತು ಹೇಗೆ ಬರ್ತದ ಅನ್ನೋದ್ರ ವಿಚಾರವಾಗಿ ತಿಳಿಸಿದ್ದೇನೆ. ಗೋಯಿಂಗ್ ಫಾರ್ವರ್ಡ್, if you actually look at it, why do we get cancers? We said one is age. ಬಹಳ ವರ್ಷಗಳ ತನಕ ನಾವು ಬದುಕಿದ್ರೆ ಕ್ಯಾನ್ಸರ್ ಬರ್ತದ ಅಂತ ಹೇಳಿದ್ವಿ. We said the longer you live, it lead on to cancers. Let me give you an example. If we live up to 70, 1 in 5 will get a cancer. 1 in 5. If we live up to 75, 1 in 4 will get a cancer. If you live up to 80, 1 in 3 will get a cancer. If you live up to 90, 1 in 2 will get a cancer. If you live 100 years, guaranteed you have a cancer of one or the other type. So that's how common cancers are. And cancers are not a disease, it's a stage of evolution. That is what you have to understand. However, why are we seeing cancers in the young? Why is somebody at 30 getting a cancer? Why is somebody at 40 getting a cancer? This is because of the risk factors. This is because of the genetic reasons. ನಮ್ಮ ದೇಹದಲ್ಲಿ ಕಣಗಳಲ್ಲಿ ಆಗ್ತಕ್ಕಂಥ ಬದಲಾವಣೆಗಳಿರಬಹುದು, ನಮ್ಮ ಒಂದು ಜೀವನ ಶೈಲಿ ಇರ್ಬೋದು, ಆ ಒಂದು ಕಾರಣಗಳಿಂದ ಬರ್ತಕ್ಕಂಥದ್ದು ಕ್ಯಾನ್ಸರ್ಗಳು ಬೇಗ. ಲುಕ್ ಅಟ್ ದಿಸ್. ಸ್ಮೋಕಿಂಗ್ causing lung cancers and oral cancers. ಸ್ತನದ ಕ್ಯಾನ್ಸರ್. We are talking today about women cancers, and we are talking about breast cancers. Did you know Bangalore is called as the breast cancer capital of India? ಭಾರತದಲ್ಲಿ ಬೆಂಗಳೂರಿನಲ್ಲಿ ಇರ್ತಕ್ಕಂಥಷ್ಟು ಸ್ತನದ ಕ್ಯಾನ್ಸರ್ಗಳು ಇನ್ಯಾವುದೇ ಪಟ್ಟಣದಲ್ಲಿ ಇಲ್ಲ. The reason is, 1, the population, 2, the lifestyle our girls are adapting to. IT, career-driven, smoking, alcohol, oral contraceptive pills, not having children, not breastfeeding, being nulliparous, all of these things are driving breast cancers. We are seeing people in their 30s with breast cancer. We are seeing pregnant women with breast cancer. How bad it can get. And part of the reason is us. I work at Banagatta Road. There are coffee shops next to us. There is HSBC Bank. You go outside any time, you have more girls smoking than boys. You go to Church Street, you have more women smoking than men. It is not about being a fashion or style. I think they think it's a sign of dominance. Unfortunately, it is causing cancers. Very, very difficult state we are in. Let us talk about obesity. The worst enemy you have is having more fat on yourself. ದೇಹದಲ್ಲಿ ಯಥೇಚ್ಛವಾಗಿ ಕೊಬ್ಬಿನ ಅಂಶ ಇದ್ದರೆ it can lead on to all the cancers: thyroid, gut, lung, breast, uterus, colon. So the most important risk factor for cancers is obesity. ದೇಹದಲ್ಲಿ ಯಥೇಚ್ಛವಾಗಿ ತೂಕ ಇದ್ದರೆ that leads on to high incidence of cancers. Unfortunately or fortunately, women have a tendency to put on more weight. Why? Because of the hormones. Estrogen, that gives you central obesity, and this converts cells to carcinogens. So it's very important, ladies and gentlemen, that you think about obesity and try and cut down your weight. Colorectal cancers, again, fatty food, processed food, etc. Look at this. This is a very important slide, but a very busy slide. If you look at 1 lakh population, 1 ಲಕ್ಷ ಮಂದಿಗೆ ಸುಮಾರು 100 ಜನಕ್ಕೆ there is cancers. Breast, cervix, ovary, uterus and lung. More than half of the cancers are just breast, cervix, ovary and uterus. The most important thing is these are all preventable cancers. If you know what to look for, you can get a cure from these cancers, something to think about. Next slide, please. Lovely. So let us just, next 20 minutes or so, talk about some, maybe 1, 2, or 3 cancers which can make a difference to us to prevent and to get cured, if at all, if you have any. I see a lot of youngsters here. How can I prevent cancer coming in the future? This is what your thought process will be. Look at this. Breast cancer, cervical cancer, leave the stomach and the head and neck, ovarian cancer. So let us talk about these 2 or 3. Breast is one of the finest organs human body has. It feeds the little one. It has got a lot of immune protection status. It actually gives you that feel of being a woman and helps you the whole of your life in one or the other way. When it is working too much, it is quite usual, normal to get into trouble. And breast cancers are quite common, as I said. So when somebody talks about a lump, now we are talking about symptoms. Symptoms andre enu? Lakshanagalu. If I pick up 1 lakh people from Malleshwaram, screen them, I'll only find maybe about 100 cancers. But if I pick up 100 people with symptoms, I'll pick up probably about 20 cancers, 25 cancers. So it is important to understand Lakshanagalu andre enu. What is a symptom? Symptom is a manifestation that cannot be explained by a reason, and that is not normal for oneself. That is what a symptom is. For example, I go to the toilet once a day. You go to the toilet once or twice a day. But suddenly, without explanation, you start having 4 to 5 times going to the toilet. And there is some blood coming as well. And you cannot explain. Your thyroxine is normal. You haven't been traveling. There is no gastroenteritis. And it has persisted for 4 to 6 weeks. That is a symptom. ಹೆಣ್ಣು ಮಕ್ಕಳಲ್ಲಿ ಸ್ತನಗಳಲ್ಲಿ ಬದಲಾವಣೆಗಳಾಗೋದು ನಾರ್ಮಲ್. During periods, your breasts feel different. During mid-cycle, your breasts feel different. During pregnancy, your breasts feel different. ಸಣ್ಣ ಸಣ್ಣ ಗಂಟುಗಳಿರ್ತವ, ಹೋಗ್ತವ, ಬರ್ತಾವ, ಹೋಗ್ತವ. But when you start suspecting a lump, which has been there, the other side it's not there, it started growing in size, it hasn't changed according to the month or the day of the month, then you start getting worried. A lump in the breast can be, a painless lump in the breast can be a sign of cancer. Something to be careful about. Lump in the axilla, kankalinalli, armpit. Because the whole breast drains to the lump, drains to the armpit. Lymph nodes anta helteve now. These are the policemen of the body. So if there's any problem in the breast, it goes to the armpit. So an unexplained lump in the armpit could be a manifestation of infection. It could be just infection, but it can also be cancer. So if there is a lump in the breast and the armpit, you need to seek help from the doctors. Nipple discharge. Lactating mothers, there's normally nipple discharge. Not a problem. But however, if you get abnormal, excessive discharge, which is not milk, which is not post-lactational, then you should be worried. You should seek help from the doctors. And obviously, skin dimpling. Breasts are smooth, soft, well contoured. But if there is any dimpling, you need to seek help from the doctors. So I'll let you read on to this for a few seconds. If you find any of the above, hardening, pinching, erosion, redness, if you think your breast has changed, if you think there is a difference in the breast, please seek help. So this is what we need to talk about today. Next slide, please. So we talk about breast self-examination. We talk about how I can find out if there's a problem with my breast. ಬಹಳಷ್ಟು ಸಾರಿ ಮುಜುಗರವಾಗ್ತದೆ ನಮಗೆ. We feel uneasy to go to a doctor, especially when there are a lot of male doctors rather than female doctors. ಮುಜುಗರವಾಗ್ತದ. You feel very uneasy to go to the doctor and say, is there something wrong with my breast? Sometimes, even if it's a female doctor, they wouldn't know much about it. ಏನಾಗೋದಿಲ್ಲಮ್ಮ, ಹೋಗ್ತಾ ಸರಿ ಹೋಗ್ತದೆ ಹೋಗು. So that is the intention you get. That is the attitude people have. And importantly, we are in an era of internet. ಅಂತರ್ಜಾಲ ನಮ್ಮನ್ನೆಲ್ಲ ಆವರಿಸಿದೆ. The first thing any woman does is they Google it. The moment you Google it, what is the first thing that comes? Breast cancer. The fear starts. So from being a well woman, you started becoming a worried well woman. So important thing is, see somebody who can understand you, or at least get confident with your breast self-examination. See, this is what we follow. If there is at the age of 20, you start your breast self-examinations. Between 20 to 40, at least one check of the breast by a doctor. At 40 plus, every year you have to get it checked. 35 to 40, start with mammograms. Every year, every 1 or 2 years, you start mammograms. So this has to be the thought process. So out here, there are so many women in various age groups. One thing that you have to learn is, how do I do a breast self-examination? Next slide, please. So it's very, very, very easy, not difficult. You mark every month, or you mark first day of your periods, or you mark whatever day in a month. Mark one day when you're taking a shower, ಸ್ನಾನ ಮಾಡುವಾಗ ನಿಮ್ಮ ಸ್ತನಗಳನ್ನು ಪರೀಕ್ಷೆ ಮಾಡ್ಕೊಳ್ತಕ್ಕಂಥದ್ದು 2 ನಿಮಿಷದ ಕೆಲಸ, and that will save your life if there is a problem, if there is anything of concern. ಬಹಳ ಸುಲಭವಾದ ಒಂದು ವಿಚಾರ ಇದು. ನೆಕ್ಸ್ಟ್ ಸ್ಲೈಡ್ ಪ್ಲೀಸ್. ಈ ಸ್ತನಗಳ ಸ್ವಪರೀಕ್ಷೆಯಲ್ಲಿ breast self-examination, what is that you look for? See, it's a methodical way. You're looking for a lump, you're looking for any dimpling around the nipple, you're looking for any discharge in the nipple, you're looking for any redness or any skin changes. How do you do a breast self-examination? Palm of your hand, up and down, circular motions, and all the quadrants. It's easy to say from 12 o'clock to 12 o'clock you feel it. Left breast you feel with the right hand, right breast you feel with the left hand. Preferably both standing and lying down. Because when you lie down, the breast becomes flat and easy to pick up any lumps. Then feel the armpits. Next slide, please. So we have talked a bit about breast self-examination and breast. Why are we talking about fundamental rights here? This is just to drive the point that right to life is in the Constitution. Article 21 gives you right to life. We need potable drinking water, good food, and a breathable air. But are we getting it is the question. Unfortunately, we're not getting it. Tell us a food which is not which is not grown without fertilizers. Very difficult to say. So you need to think about not just about living, but living well. So if you go back to the history, cancers have been there from times immemorial. In fact, the research for chemotherapies happened during the Second World War by chance. And we have come too far now with cancer studies and cancer treatments. Next slide, please. This is what we are talking about. When we talked about the cancer journey, we talked about having a lump, a symptom. From having a lump, we talked about going for an examination with the doctors or yourself. Then when they get to the investigation stage, you may have a mammogram, you may have an ultrasound, you may have a PET CT, you may have an MRI. But whatever it is done, they want to look at those cells after a biopsy that they are abnormal. ಆ ಒಂದು ಕಣಗಳು ಕೆಟ್ಟ ಕಣಗಳು ಅಂತ ನೋಡಬೇಕಾಗ್ತದ. After that, you actually start telling it is a cancer or not. Not all cancers are bad, ladies and gentlemen. I give an example of a prison. In a prison, there are about 5 or 6 prisoners. Are all 5 prisoners the same? Not really. One has come with a pickpocket, one has come with a theft, one has come with a rape, one has come with a terrorist attack. So not all cancers are the same. Within the cancers, you have the good cancers, you have the bad cancers, and you have the ugly cancers. That is what happens with breast cancers too. We talk about hormones and hormone markers. Next slide, please. So this is what we are looking through. When we talk about the good, bad, and the ugly cancers, people will say, oh, it is hormone negative. Oh, it is hormone positive. So what is that we are trying to characterize? We are trying to characterize, is it a good cancer, is it a bad cancer, or is it a ugly cancer? The next thing we do in the cancer journey is stage it. People say it's stage 1, stage 2, stage 3, stage 4. But what does it mean for a common man? Stage 1 ಅಂತ ಹೇಳಿದ್ರೆ, the cancer, ಆ ಗ್ರಂಥಿ ಎಲ್ಲಿದೆ, ಸಣ್ಣದಿದೆ, ಅಲ್ಲೇ ಇದೆ. It is there, it is less than 2 centimeters, and it has not gone anywhere else, it's stage 1. ಸ್ಟೇಜ್ 2, ಆ ಕ್ಯಾನ್ಸರ್ ಗ್ರಂಥಿ ಎಲ್ಲಿ ಉದ್ಭವವಾಗಿದೆ ಅಲ್ಲೇ ಇದೆ, ದೊಡ್ಡದಾಗಿದೆ, ಸ್ಟೇಜ್ 2. ಸ್ಟೇಜ್ 3, ಈ ಗ್ರಂಥಿ ಎಲ್ಲಿ ಉದ್ಭವವಾಗಿದೆ ಅಲ್ಲೇ ಇದೆ, ಪಕ್ಕದಲ್ಲಿ ಸಣ್ಣ ಸಣ್ಣ ಮರಿಗಳು ಹಾಕಿದೆ, ಲಿಂಫ್ ನೋಡ್ಸ್ ಆರ್ ಪಾಸಿಟಿವ್ ಅರೌಂಡ್ ಇಟ್. ಸ್ಟೇಜ್ 4, ದ ಲಂಪ್, ದ ಗ್ರೋತ್, ಆ ಗ್ರಂಥಿ ಅಲ್ಲಿದೆ, ಬಟ್ ಬಹಳ ದೂರಕ್ಕೂ ಕೂಡ ಹೋಗಿದೆ. ಇಟ್ ಹಸ್ ಟ್ರಾವೆಲ್ಡ್ ಫಾರ್, ಇಟ್ ಹಸ್ ಗಾನ್ ಟು ದ ಲಂಗ್, ಇಟ್ ಹಸ್ ಗಾನ್ ಟು ದ ಲಿವರ್, ಇಟ್ ಹಸ್ ಗಾನ್ ಟು ದ ಬೋನ್ಸ್. ದಟ್ ಇಸ್ ಸ್ಟೇಜ್ 4. ವೈ ಇಸ್ ಇಟ್ ಇಂಪಾರ್ಟೆಂಟ್? You felt a lump 2 years ago and you felt the lump was small and you ignored it. 2 years later, it is spread everywhere and you realize, oh my God, I could have picked it up 2 years ago. At that point, I could have cured you, but now there is no cure. So that is how important. Thinking about symptoms is important. Thinking about, seeking help is important. The most difficult thing we find as doctors, ladies and gentlemen, is not the treatment, not the operation, not giving you chemotherapy, not giving you radiotherapy. You know what it is? It is decision making. We say in surgery, decisions are difficult than incisions. That's what the bankers do all the time. They do risk assessment. They do the scoring. They say if you do not score more than 80, your interest rate is high. They're trying to assess the risk and they're trying to communicate the risk. And that is the problem we find. Every treatment, the difficulty is the decision making, not the action. We say incisions are easier than decisions, or decisions are difficult than incisions. And that is what we struggle with, and that is the reason we have a meeting called as a tumor board meeting, cancer board meeting. 10 of us or 15 of us sit down and talk to each other. Talk to each other about Mrs. Lakshmi, who has come to us with a lump in the breast. We tell them, Mrs. Lakshmi is 52, normally fit and well, has got hypertension, had a lump in the right breast, measured about 2 centimeters. A mammogram showed features suggestive of cancer. Biopsy done, shows a hormone-negative breast cancer. What is that we should do? Had it not been a tumor board, had it not been a cancer decision board, had you been to a doctor who is a radiation oncologist, he would say, radiation ಸ್ವಲ್ಪ ತಗೊಳಮ್ಮ ಆಮೇಲೆ ನೋಡೋಣ. You would have had radiation and then he would pass the patient on to a surgeon. Had it been a medical doctor, he would say, ಸ್ವಲ್ಪ ಹಾರ್ಮೋನ್ ಥೆರಪಿ ತಗೊಳಮ್ಮ ಆಮೇಲೆ ನೋಡೋಣ, ಹಾರ್ಮೋನ್ ಥೆರಪಿ ಆದಮೇಲೆ, ಕೀಮೋಥೆರಪಿ ಆದಮೇಲೆ ಸರ್ಜನಿಗೆ ಕಳಿಸೋಣ. Had it been a surgical oncologist, he would say, let us just take this lump off and then I'll pass it on to the chemotherapist or radiation therapist. And there is a problem here. The problem is there is conflict of interest. How much ever we love India, India is a capitalistic country for healthcare. We see opportunity even when somebody is dying. Unfortunately, that is the state we are in. To prevent these things, these tumor boards help. So what I want you all to talk to, what I want you all to understand, next time any of your member, family member, relative, friend is in the hospital, you say, can I have the tumor board discussion notice, please? There, you cannot do a wrong thing when there are 15 people sitting. So this is the most important thing. Anybody with cancer cannot have a treatment without the tumor board discussion. Something to take home from. Next slide, please. Next slide, please. Next slide, please. Next slide, please. So what these cancers do, ladies and gentlemen, is they don't spare anybody. They don't spare the rich. They don't spare the poor. Ninu Bangalore nava, nanu Mysore nava, the cancer doesn't differentiate. The cancer doesn't differentiate nanu badava, ninu Srimanta, no. It doesn't differentiate the royals and the commoners. What it does is, it categorizes people into 3 different groups. It picks people based on the psychological state, based on the fighting spirit, based on how strong they are psychologically. If you look at these people, look, some are winners, Yuvraj Singh, okay? Some are losers, our politician, our Anant Kumar. So what it does is, it categorizes people into 3 groups. Winners or fighters, people keep fighting and losers. The group which fight are the survivors. The group which keeps fighting are still fighting. The group which lose out are the losers who lose their life to cancer. So the learning lesson from this is psycho-neuro-immunology. ಮಾನಸಿಕವಾಗಿ ನಾವು ಶಕ್ತಿಯುತವಾಗಿದ್ದರೆ, if you are strong mentally, half the disease is won. You don't need medical oncologists. Psycho-neuro-immunology tells, that is the reason ನಾವು ದೇವರನ್ನ ಹೋಗಿ ಕಾಣ್ತೇವೆ. ದೇವರಲ್ಲಿ ಅಷ್ಟು ನಂಬಿಕೆ ಇಟ್ಕೊಂಡಿರ್ತೇವೆ, ನಾನು ಈ ಗುಡಿಗೆ ಹೋಗಿ ಬಂದರೆ ಕ್ಯಾನ್ಸರ್ ಹೋಗ್ತದಪ್ಪ, ಬರೋದಿಲ್ಲಪ್ಪ. ಆ್ಯಂಡ್ ಇಟ್ ಡಸಂಟ್ ಕಮ್. ಯು ನೋ ವೈ? ಇಟ್ ಇಸ್ ನಾಟ್ ದ ಭಗವಾನ್, ಇಟ್ ಇಸ್ ದ psycho-neuro-immunology. A robust thinking, yoga, meditation, positive thinking triggers your hypothalamus. The hypothalamus triggers your pituitary. The pituitary triggers your thymus. And what does thymus do? It produces T cells. What are T cells? These are fighter cells for cancer. And that is what we have to drive towards, being strong mentally. And this is science. This is not what we are talking, this is science. ಒಂದು 15 ವರ್ಷಗಳ ಹಿಂದೆ ಒಂದು ಎಕ್ಸಸೈಸ್ ಮಾಡಿದ್ರು. ಎಕ್ಸಸೈಸ್ ಅಂತ ಹೇಳಿದ್ರೆ, ದೇ ಡಿಡ್ ಅನ್ ಎಕ್ಸ್ಪೆರಿಮೆಂಟ್. ವಾಟ್ ವಾಸ್ ದ ಎಕ್ಸ್ಪೆರಿಮೆಂಟ್? ಎ ಸ್ಟಡಿ, ಎ ಟ್ರಯಲ್. HCG in Bangalore and MSKCC in United States. Group matched, stage matched breast cancer patients. Group matched, stage matched breast cancer patients. Same, ade stage, ade group. Here they gave them positive thinking, yoga. There they said, do what you want. And they measured things. This Indian group was more happier. Indian group lived longer. Indian group had less depression. And Indian group had less pro-inflammatory cytokines in the blood, which means the yoga that they were doing was helping. Something to seriously think about. Next slide, please. So once we know what the problem is, treatments are different. It could be radiotherapy, surgery, medical therapy, oncotherapy, immunotherapy. That is different. But the problem is the decision making. That is what you should be clear on. Next slide, please. Next slide, please. So now, ladies and gentlemen, I've talked a bit about breast cancer. The two big cancers in women we talk about are breast cancers and cervical cancers. So I've touched on the most important aspect, especially for the young women and the middle-aged women here. As good as the breast cancer is the cervical cancer. And this is preventable. This is preventable. Maybe in 20 years, we might not see anybody with cervical cancers. And it is important you understand about cervical cancers. Look at that. If you go back to 1982, look at the cervical cancers, very high. Half of it was breast cancers. But look at it now. More breast cancers and less cervical cancers because of cervical screening. Pap smears. So let me give you an idea. Next slide, please. So like we have breast tissue, cervix is the neck. ಗರ್ಭಕೋಶಕ್ಕೂ ಯೋನಿ ದ್ವಾರಕ್ಕೂ ಮಧ್ಯೆ ಇರತಕ್ಕಂಥ ಒಂದು ಭಾಗ, ದ್ವಾರ, cervix. It goes through a lot of changes. And this cervix, when it goes through a lot of changes, the cells can change to bad cells. ಇದನ್ನ ನಾವು ನಮ್ಮ ಭಾಷೆಯಲ್ಲಿ cervical intraepithelial neoplasia ಅಂತೇವೆ. When these change, they change from 1, 2, 3 abnormal, then dysplasia, then cancer. You can catch it anywhere when they are changing, and that's what we are trying to do by doing cervical smears. Look at this. I don't know how many of you remember Jade Goody. When we were growing up, Jade Goody was an actress. She died at 27. She had cervical cancer. Next slide, please. So that is what your cervix is. Garbhakosha, motte chila, ಮತ್ತೆ ಕೆಳಗಡೆ ಯೋನಿ ದ್ವಾರ, ಇಲ್ಲಿರ್ತದ ಸರ್ವಿಕ್ಸು. So that is what actually gets into trouble when people have cervical cancer. Next slide, please. So how are we preventing? India has done so well in preventing cervical cancers. What is that we are doing? All that we do is take a bit of a biopsy from here. It is not a big test. It is just a small brush, a soft brush that goes into your cervical canal, takes some cells off. This is the area they are checking, puts it on the microscope, they check for any abnormal cells. If there are any abnormal cells, then they treat it. Majority of the times you pick up this, it's a cured cancer. So that's how simple pap smear is. So everybody above the age of 30 above age of 35, we'll come to the guidelines, should have a pap smear. It's a 2-minute test, but it can save lives. Next slide, please. This is what we say. Everybody above the age of 25 or 3 years after they start having sex. If somebody gets married at 18, they should have a pap smear after 21. So this is, again, for the young girls here, okay? Every 3 to 5 years till the age of 65. So you start at 25, having pap smears, or 3 years after you're married. And you go until about 65 years of age. The most important thing we are seeing now is vaccines. This is what is revolutionized. If somebody told 25, 30 years ago that you can prevent cancers, people wouldn't believe. But now we are preventing cancers. They use 2 different virus strains, and in fact, there's one more which protects against 4 different ones. So pap smears are important. Vaccinations are vital, especially for the younger girls here. We do vaccinations at a much early age. Next slide, please. If you look at it, this is the status of vaccinations today. You can give a vaccination for all men from 9 years old to 45 years old. 9 years old, even before they start having physical contact or sexual activity. And it's also recommended for boys now because HPV can cause penile cancers. Next slide, please. So this is what is the recommendation. Child is more than 15 years, 3 shots over 6 months, to be given 1 or 2 months after the first dose. So I think for all the mothers here, for all the fathers here, for all the young girls here, if your family members or anybody in that age group, they have not had a vaccination for cervical cancer, it is the first thing you have to do. Very, very, very important. So left over the other cancers. So we have talked about breast cancers in detail. We have touched on cervical cancers. Ovarian cancers are from the ovaries. Motte chilagalinda bartakanta cancer. It normally produces abdominal swelling, ಹೊಟ್ಟೆ ಉಬ್ರ ಬರ್ತಕ್ಕಂಥದ್ದು, ಹೊಟ್ಟೆಯಲ್ಲಿ ನೀರು ಬರ್ತಕ್ಕಂಥದ್ದು, ವೆಯ್ಟ್ ಲಾಸ್ ಆಗ್ತಕ್ಕಂಥದ್ದು, ಹೊಟ್ಟೆ ನೋವು ಬರ್ತಕ್ಕಂಥದ್ದು. ದೋಸ್ ಆರ್ ದ ಸಿಂಪ್ಟಮ್ಸ್ ಆಫ್ ಒವೇರಿಯನ್ ಕ್ಯಾನ್ಸರ್. ಯೂಟ್ರೈನ್ ಆರ್ ಎಂಡೋಮೆಟ್ರಿಯಲ್ ಕ್ಯಾನ್ಸರ್ ಬಹಳ ಮುಖ್ಯ. ಇಫ್ ಯು ಹ್ಯಾವ್ ರೀಚ್ಡ್ ಮೆನೋಪಾಸ್, ಮಾಸಿಕವಾಗಿ ರಕ್ತಸ್ರಾವ ನಿಂತ ನಂತರ, ರಕ್ತಸ್ರಾವವಾದರೆ ಯು ಹ್ಯಾವ್ ಟು ಗೋ ಅಂಡ್ ಸಿ ಎ ಡಾಕ್ಟರ್ ಬಿಕಾಸ್ ಯು ನೀಡ್ ಟು ಮೇಕ್ ಶ್ಯೂರ್ ಯು ಡೋಂಟ್ ಹ್ಯಾವ್ ಎನ್ endometrial cancer or vulvovaginal cancer. Next slide, please. ಇದಕ್ಕೆಲ್ಲದಕ್ಕೂ ಕಾರಣ, all the cancers we have spoken so far, whether it's breast cancer, cervical cancer, endometrial cancer, majority of it is lifestyle. The processed food, the fatty food, significant red meat, alcohol, smoking, all of this is what is causing this change. And one of the main things that we have done is we have moved away from the Indian culture. We have moved away from our traditions. We have moved away from what was norm for us. We are into fast foods. We are into processed foods. We are into a life which is difficult to go back to, but it is important. So a traditional Indian food can actually prevent a lot of cancers. The way we used to eat before, even that matters. The way we go to the toilet, that matters. And telomere effect, very important. ನಮ್ಮ ಭಾರತ ಸಂಸ್ಕೃತಿಯಲ್ಲಿ ಉಪವಾಸ ಮಾಡ್ತಿದ್ವಿ ನಾರ್ಮಲಿ 15 ದಿನಕ್ಕೊಮ್ಮೆ, ಅಮಾವಾಸ್ಯೆಗೆ, ಪೂರ್ಣಿಮೆಗೆ, ಏಕಾದಶಿಗೆ. ಆ್ಯಂಡ್ ಫಾಸ್ಟಿಂಗ್ ಇಸ್ ಸಚ್ ಅನ್ ಇಂಪಾರ್ಟೆಂಟ್ ಥಿಂಗ್. ಈಗ ವಿ ಹ್ಯಾವ್ ಗಿವನ್ ನೇಮ್ ಆಸ್ 18-hour ಫಾಸ್ಟಿಂಗ್, ಇಂಟರ್ಮಿಟೆಂಟ್ ಫಾಸ್ಟಿಂಗ್. ಬಟ್ ದ ಫ್ಯಾಕ್ಟ್ ಇಸ್, ಸೈನ್ಸ್ ಟೆಲ್ಸ್ us your body should starve now and then. The telomere effect is the speed with which the chromosome shortens dictates how fast you age. So if you fast regularly, you stay young. That is the bottom line. So fasting is a very important thing. Some medications may help. Exercise helps. Next slide, please. Next slide, please. Laughing helps. Breastfeeding surely helps for preventing breast cancers. Meditation helps. Laughing helps. Good diet helps. Next slide, please. Next slide, please. So, ladies and gentlemen, I'm only 2 minutes away from closing this talk. If you can take one slide from this talk, one slide from the last 45 minutes I've spoken, it is this. We have to move from an urban lifestyle to a rural lifestyle. We have to move from the chaos of an urban lifestyle to a rural mindset. Not that you buy a villa in Sakleshpur and take the internet and work with you. ಮಾನಸಿಕವಾಗಿ, ದೈಹಿಕವಾಗಿ, ಸಾಮಾಜಿಕವಾಗಿ, we have to go back, we have to cool down ourselves. This is what will help you to gain good health and live longer. Next slide, please. Next slide, please. ಹಾಗಾಗಿ ಸ್ನೇಹಿತರೆ, the last 45-50 minutes, I've told you, I've emphasized on you, we are living longer. We are living almost 70 years now. And we are also living well. Thinking cancer is a disease is wrong. The fear is more worse than the foe. ಆ ಶತ್ರುವಿಗಿಂತ ಶತ್ರುವಿನ ಭಯ ಹೆಚ್ಚಾಗಿದೆ ನಮ್ಮಲ್ಲಿ. And the system is misusing it. Doctors are misusing it. Corporates are misusing it. What we all need to learn is, it is a stage of evolution. Diabetes is more worse than a cancer. And I'm very grateful to Canara Bank today and MLA College. We have put this talk together because we can understand cancer can come to anybody. When it comes, it's a small problem which we can solve it. But make sure you have a fallback financially. And I think that is where it is really great that Canara Bank is introducing an insurance policy for the cancer patients. Let them give a big round of applause for putting this together. Okay? So, it's not all bad. If you actually look at it, how many of us have gone through cancers in the family and they're all living well? So it's about shedding that fear of cancer, and it's actually that hope. And in fact, what Canara Bank is doing today is giving that hope for a cure, for a better life, to have that strength and provide happiness. And I think that is where we should be thankful to the bank for putting this product together. Today, I'm here to spread this awareness about health, cancers, and cancers in women. That is a job, that is a responsibility I have. So each one of you carry the same responsibility. What I spoke to you today, you just speak to one. Not more, not less. Just one is good enough. So at a population level, we need to create awareness. When there are symptoms, seek advice and reduce the risk factors. At a professional level, this is what I'm trying to do today. At a policymakers level, let us work on bringing some screening programs. Stopping the tobacco they sell, bringing down the alcohol they sell, cutting down on the fast food shops they have, so on and so forth. Next slide, please. Next slide, please. So let us be the change we want to see. Arise, awake, stop not till the goal is reached. So said Vivekananda. And you, us, we are all together. Let us be the warriors to break this fear of cancer, and let us bring this world to a better shape where we can prevent people from having cancer. Next slide, please. We talk about a lot of things. We doctors, we talk about what we can do. I'm not a proponent of Sadhguru or Ravi Shankar or anybody of that nature. But what these people have been doing is, they have been propagating knowledge, science, philosophy. If I deal with the cancer, they deal with the prevention. If I deal with the cancer, they deal with the rehabilitation. So much important, and they're actually working on the psychoneuroimmunology. Your pranayama, your inner engineering is nothing but driving those energies. Vata, Pitta, Kama. These are the three important things which they are working on. Absolutely something that I recommend. And when you actually look at them talking, as a doctor, you think, wow, it makes so much of sense. So something for you all to think about. Next slide, please. Again, to re-emphasize, this is some work I did. Decisions are very, very difficult. And always look for that right decision when somebody is being struck with a cancer. Next slide, please. Next slide, please. Thank you, ladies and gentlemen. I'm really grateful that I had this opportunity. To talk to you, to put across what is very passionate to me. trying to share that knowledge I have, especially with the youngsters, especially with the women of the right age group. If even 2 of this group of patients go back to a cervical smear, if 5 of the girls there go back for a pap smear, if they're sexually active, and they have vaccinations, my job is well done. So let us all work this together and take the help of the bank. That small money you invest for that product of Canara Bank might be a lifesaver. Something to seriously think about. I'm not here on behalf of bank. I'm not getting paid by the bank to talk to you about it, but I'm very grateful to them because they put up this program together so that we can educate our people, so that we can have a better world and it will be a true Vasudhaiva Kutumbakam. One world, one family, all hail, healthy and happy. Thank you one and all. I'll be happy to take any questions once we are done here, sir.
You can have, I think, 5 to 10 minutes you can spend with the doctor for having questions if it's okay with you. And it was a great passion with which the doctor was speaking. So we all got inspired, whether it is there or not, we got awareness. I think big round of applause for doctor for coming over here. And I think it's a privilege to hear him and the passion with which he was speaking. It was really inspiring for all of us. So I think you can have some questions for the doctor. Please.